Hello, fellow classmates. We are here today to tell you about epilepsy. I'm Carissa.
I'm Harrison. I'm Steven.
Michelle. And Lee is also in our group, but she unfortunately could not film with us today. Thank you.
Epilepsy is the fourth most common neurologic disorder. This disease consists of a continuing predisposition to seizures with neurologic, cognitive, psychologic, and social consequences. Epileptic seizures can be categorized into multiple types. For example, you have generalized seizures that involve both hemispheres of the brain, as well as focal seizures that only involve one hemisphere. For most people with epilepsy, it's a chronic disorder that can drastically affect their lives. There's currently no cure, however, seizures and other symptoms that come with it can be managed with medications such as anti-seizure drugs as well as other medications.
Seizure is a temporary, uncontrolled electric discharge of neurons in the brain that disturbs everyday function. A seizure can be organized into many different types, and one specific one is epilepsy. Epilepsy is considered a recurring seizure. It is caused by abnormal neurons that endure spontaneous firing. The accidental firing spreads throughout the nervous tissue around the brain by psychological pathways. These pathways involve adjacent or distant areas of the brain. An imbalance of excitement and decrease in inhibition inhibits abnormal electrical discharges. Any stimulus that causes a neuron's cell membrane to depolarize introduces spontaneous firing. The area where the accidental firing is happening is called seizure focus, which is essential for any surgical treatment. Scar tissue can also develop in the areas of the brain. The scarring interferes with the brain neurons' standard chemical and structural environment. The scarred areas of the brain can make the neurons fire off even more spontaneously. And also many scholarly articles have stated that the pathophys behind the spontaneous firing of epilepsy is still unknown.
Hey everyone, this is Lee's part of the video. She unfortunately was sick and lost her voice and could not record, so she made a couple slides for me and sent me all the information to speak for her part. So here it is. The categories of epileptic seizures include primary generalized seizures and focal seizures, with a total of 8 different types of epileptic seizures. Generalized seizures involve both hemispheres and can be categorized as probable altered consciousness with 2 subcategories. So we have tonic-clonic seizures, which is the most common type. The patient is usually unconscious and lasts about 10 to 20 seconds. Myoclonic occurs in clumps. A specific muscle group contracts, the limbs will jerk and last a few seconds. Absent seizures are also known as childhood seizures and last less than 10 seconds. Tonic affects the extensor muscles of the limbs and they become stiff. And this can last up to 20 seconds. Clonic seizures are rare. The patient's unconscious and loses all muscle tone. A tonic is sudden onset. The patient's unconscious skeletal muscles can be affected and last up to 15 seconds. Myoclonic, tonic, and clonic and atonic are considered altered conscious seizures. Focal seizures initiate on the cortex in one hemisphere of the brain. Symptoms vary depending on the region of the brain that is involved. They may include emotional, cognitive, sensory, and motor symptoms. There are 2 types. The first is simple focal seizure. The patient remains conscious when affected. Sudden jerking can happen. The patient can have unexplained sense of joy or happiness, or feelings sometimes cannot be there, and this can last up to 90 seconds. The second is complex focal seizures. The patient loses consciousness they're unaware of the environment. They might start lip smacking, taking off their clothes, going on shopping sprees, doing things that just don't make sense, and this can last up to 2 minutes. For treatments, medication is the most common way to control epileptic seizures because epilepsy cannot be cured. The most common types of drugs are phenytoin, carbamazepine, or valproic acid are the most common drugs. Another treatment is surgery. This is used for patients who respond poorly to medications. The surgeon will open up the cranium and take a little bit of the brain tissue that has been scarred by recurring seizures, and hopefully this will help the seizures. Another cool treatment is a vagus nerve stimulation, or VNS. It is approved to treat focal or partial seizures that do not respond to medication. VNS may prevent or lessen seizures by sending regular mild pulses of electrical energy to the brain via the vagus nerve. The therapy consists of a device that is implanted under the skin in the left chest wall. An electrode or wire is attached to the generating device and placed under the skin. A person with a VNS device is usually not aware of the stimulation when it is working. If a person is aware of when a seizure happens, they can swipe a magnet over the generator in the left chest to send an extra burst of stimulation to the brain to hopefully stop the seizure.
A journal article on the management of epilepsy in children and adults discussed the different management often implemented for patients with epilepsy. The first management method implemented is the use of anti-epileptic drugs, or AEDs. AEDs accomplish seizure-free events in about 2/3 of patients in their study. Even though AEDs have not altered the overall seizure-free outcomes, AEDs still present with opportunities to be modified for treatment in future patients. A second management method in treatment for epileptic patients includes an incorporation of a ketogenic diet. So what a ketogenic diet is a diet rich in lipids and low in proteins and carbohydrates. This results in an increased production of ketones. Basically, ketones serve as an energy source in the diet, and the conversion from glutamate to GABA takes place. And the synthesis of GABA increases, which in turn results in the inhibition of fast electrical signaling that is often associated in patients with epilepsy. The third management method for treating a patient with epilepsy is the use of a seizure diary. So basically what sets apart from a seizure diary and a EEG is that a diary can tell what is going on in daily life for an individual with epilepsy. Keeping track of what happens during a seizure and how often an event occurs are the two most significant details in the diary. Keeping a seizure diary allows for the nurse to understand what is going on and how to respond to the seizures. Tracking when and what happens during the time an event occurs can help recognize the possible trigger factors before seizure happens. Common triggers include missed seizure medications, a lack of sleep, changes in medicines. Priorities in patients with epilepsy are often set between the patient, the nurse, and the physicians. A study involved 21 centers with epileptic patients with a questionnaire that patients filled out anonymously. The questionnaire pertained to the priorities and needs in the management and priorities of epilepsy. The questions were on the patient's diagnosis and treatment for epilepsy and the outcomes of their treatments. Upon the results of the questionnaire, the priorities for epilepsy were made. Even though the priorities varied upon gender, age, and education, the top 3 priorities were set. With 432 women and 355 men aged 15 through 88 years old, the top 3 choices for priorities included the use of the right drug without chronic side effects, which was about 98.7% of the participants, discovery of the cause and the implementation of safety during seizure occurrence, which was about 94% of the participants, and implementing a life without restrictions, which was 90.4% of the participants. Most of the individuals in the study were most concerned on a new anti-epileptic drug that showed a good control of seizures and had a possibility of an association of short-term and long-term side effects. Upon the results, nurses can carry out patient-centered care for patients with epilepsy.
In conclusion, epilepsy is a condition that affects approximately 65 million people worldwide. For 70% of those people, their symptoms can be well managed with the right combination of medications, lifestyle, and diet modifications. Approximately 20% of people that have been diagnosed with epilepsy are unresponsive to any traditional treatments that we currently have available. In terms of death, a majority of deaths in epilepsy are not a direct result of the seizure. Instead, a majority of patients with epilepsy die from asphyxiation or injury during the seizure. There is one condition called SUDEP, or sudden unexplained death in epilepsy, which accounts for approximately 2% of patients who die during a seizure. The underlying cause of these deaths remains unknown, and people are still trying to figure out why they die during those seizures. Overall, epilepsy is a condition that can be well managed for a majority of the people diagnosed.
Pop quiz with Steven.
Question number 1. Death caused by epilepsy commonly occurs as a result of which of the following? Select all that apply. A. Respiratory distress. B. Injury. C. Asphyxiation. Or D. Unexplained causes. Take some time, think about it. And the answer is all of them. A temporary, uncontrolled electrical discharge of neurons in the brain that disturbs everyday function is referred to as A. Myocardial infarction, B. Seizures, C. Stroke, or D. Sepsis. The answer is B. Seizures. Question number 3. This type of seizure initiates on the cortex in one hemisphere of the brain. Is it A. Generalized seizures, B. Absence seizures, C. Focal seizures, or D. Tonic seizures? The answer is C. Focal seizures.
Do you ever look at someone and wonder what is going on inside their head?
In conclusion, okay, we're gonna start that.
I saw a Spider-Man post on Facebook.
I'm gonna make our video 15 minutes by the bloopers.
So what do I do with my hands?
The second implementation. Dang it, sorry. A second method of. One more time. Journal. The journal. A journal. Okay. I'm here grinding in this small space.